Hello, my name is Dr. Crystal Simmons, and I am from Texas A&M University, and we are one of the awardees of the APEC 2020-2021 Calls to Action on Telesupervision and Teletraining. As noted, I am a clinical professor at Texas A&M University, the director of clinical training for the school psychology program, and I'm also the executive director of the Counseling and Assessment Clinic. Dr. Kelly Lee was also a contributor. She is a clinical associate professor in the counseling psychology program, the director of clinical training for that program, and is also the director of the Counseling and Assessment Clinic. Dr. Sarah McCorkle is a clinical assistant professor in the Learning Design and Technology program. She is also the director of instructional design for distance education. In addition to the 3 faculty members, we had a number of awesome graduate students who were collaborators for this project. And we have one of those graduate students who is on this video introducing our project summary.
Thank you, Dr. Simmons. My name is Pamela Santiago Tamarez. I am currently a doctoral student in the school psychology program at Texas A&M University. And as Dr. Simmons mentioned, I was part of the collective of graduate students who contributed to the development of this web tool. This web tool is designed to scaffold learners' knowledge and skills in conducting telepsychology services. The objective is to utilize training content as a supplement to a telepsychology training and supervision program. With this, learners will start with modules to help them understand the ethical considerations and challenges of telepsychology engagement. They will learn basic concepts of telepsychology. They will learn best practices for teletherapy and teleassessment, including conducting risk assessments and ensuring safety. They will also develop culturally informed clinical skills for teleassessment and teleintervention. There is a module that is specific to multilingual considerations, and they will also learn about special populations such as child cases, working with clients who identify as having a visual impairment, and recommendations for trainees with disabilities who provide telepsychology services. We also plan to have more innovative and evolving content for years to come. Future training models will also include recommendations on developing a telepsychology clinic and training program, supervising students on telepsychology, interactive training modules for trainees, more case studies, and training and clinic document templates that can be adapted to your clinic or training site's needs.
So we see these web tools that we have created, known as T-Psych 101, as applicable to doctoral, internship, and postdoctoral trainees, specifically those who are novice therapists and they're trying to make the transition into telehealth. But we also think that this information can be useful to life learning opportunities, especially those who have not engaged in telepsychology services as of yet. And so how people can utilize the tools is to access our website, which is www.tpsych101.com, and the QR code will take you straight to our website. Within that website, we have modules that are written out so the learner can engage in that learning at a self-paced timing. It also can be very helpful as a supplement to a full telehealth training model that has been implemented by either a course, a clinic, or a training site. In addition to these self-paced modules, we have video content and also case studies to supplement knowledge, skills, and abilities to help the learner engage in self-reflective practice, and also really in-depth discussions with peer groups and their supervisors. So as mentioned, we'll utilize the content to scaffold learning, to help the learner engage in reflective practice, but then furthermore, build on those skills so that they can then implement all of this information within a telepsych environment. So if you have any questions about the project that we have created and the curriculum, in addition to any feedback that you want to provide, you can reach me at tpsych101@gmail.com. Our number is listed there at 979-595-1770, and you can access our website at www.tpsych101.com. We thank you and we appreciate your interest. And we really look forward to any feedback and questions that you would like to offer us.